Ronald Lloyd-Jones from Northwestern University, and I'm the immediate past president of the American Heart Association. I'm so pleased to be here at the American Heart Association's Epi and Lifestyle Conference held in Boston this year with two of my colleagues, Dr. Michael Grandner from the University of Arizona and Dr. Seth Martin from Johns Hopkins University. We're here today to talk about a really exciting session that's happening today at the Epi meetings. We're going to look at a number of AHA statements and guidelines that have recently been released. We're going to focus on particularly a couple of things that I think are important for our viewers to know about. The first is that last year there was a presidential advisory that updated the construct of cardiovascular health. What we used to think about as Life's Simple 7 is now Life's Essential 8. And the reason for that is that we knew that there were changes that need to be made to the way we measured cardiovascular health. So we updated the scoring system to account for a broader range of the health behaviors and health factors that go into cardiovascular health, and that would give people more credit for improvements in their cardiovascular health. But importantly, we also added the 8th metric, which is sleep. So happily, I have my friend Dr. Grandner here, who's an expert in sleep. And Michael, what is it about sleep that's so important that underlies all the rest of cardiovascular health?
Yeah, sleep is a foundational physiologic set of processes. So it impacts regulation of many systems, including metabolism, circulatory system, inflammation, all of these things, as well as things in the brain like decision making and emotion regulation that also impact behavior. All of these together all converge on cardiovascular health.
So when I talk to my patients about cardiovascular health and sleep and how important it is, I remind them that the heart is a muscle, just like all our other muscles, but it actually never gets to rest, right? Hopefully. And so it's imperative we have that downtime, and that's just as important for our brain, right? And you talked about decision making. Maybe unpack that a little bit.
Sure. It's much easier to change your car's oil while you're not driving it. And that's what sleep does. So it allows your body to do all the things for maintenance, rejuvenation, recovery, regeneration, that it's hard to do while you're engaging with the environment. And that's doubly so for the heart, which is constantly engaging. From the brain perspective, anyone who hasn't had a good night's sleep can tell you that sleep plays important roles in your ability to process information, make long-term decisions, and that's why we show things like sleep loss leading to problems making strategic decisions, making health-related decisions, where you're more focused on sort of how I feel right now, rather than being able to make those more long-term decisions.
You mentioned also sleep's kind of role in metabolism, and I think we all have experienced that situation where the next day after a bad night's sleep, we're more likely to reach for the donut or the high-carb meal. So could you talk a little bit about that?
Yeah, it's really interesting how sleep does conserve some energy, but the bigger role seems to be that sleep plays roles in regulating metabolic hormones. It seems to play roles in regulating insulin and glucose management, and even just the thought processes behind appetites and cravings. All of these things, again, they all sort of come in together, and sleep plays roles in all of them. That's why people who are not getting that recommended amount of sleep, the meta-analyses show an elevated obesity risk of something like 55% incident obesity risk.
Yeah, that's a really incredible statistic. Yeah. So one of the things that we also think about when we think about cardiovascular health is we're always striving to help people improve it. Yeah. Can people improve their sleep?
Yeah, well, that's the other thing. I mean, dietary and physical activity interventions, there's lots of them, and they have varying levels of efficacy. We have sleep interventions too. And actually, sometimes sleep interventions are easier to accomplish. We have all kinds of behavioral data. There's a whole field of behavioral sleep interventions that we can deploy, and some of them are relatively simple, so we can do it.
When I think about this, and again, when I talk to my patients, there are some simple things that we need to get people in the habit of doing, like going to bed at the same time every night, right? Waking up at the same time every morning, even if it's a weekend.
Your body doesn't know what weekends are.
That's true.
It likes regularity.
But maybe most importantly, right? Turn off the lights. Get the screens away from your bedside table so that your sleep isn't interrupted and you're not having a bright light shining right in your eyes.
Especially busy professionals, a lot of times they'll say, well, I get into bed and I just can't turn my mind off. And that's kind of like saying I'm driving the car and I want to stop at the stop sign, but I just keep going. So then I ask, well, when did you start braking? And they'll say 2 millimeters before the stop sign. And how fast were you going? 70 miles an hour. Well, no wonder why you didn't stop. You need to give yourself the mental and physical space you need so that your mind and body is ready. We're not computers. We can't just press a switch and turn off. We need to give ourselves that time and space, which means light, which means screen, which means other things that are mentally stimulating. Give yourself that time.
Caffeine, eating too close to bedtime.
Yeah, all those things,
like that,
and those things become metabolically active and have all kinds of physiologic barriers to sleep as well.
Mhm. Great advice for both our professional colleagues, but also our patients, right?
Yeah.
So terrific. So one of the other things we're going to highlight in the session today here at AHA Epi is what I think is the most important publication that the Heart Association puts out every year. It's the statistical update, which really catalogs the entire burden of cardiovascular disease in the U.S., soup to nuts, the risk factors, the outcomes, the costs, and increasingly also covers a lot of those data from across the globe. So we're really pleased to be joined by Seth Martin, who's the chair of the Statistics Committee for the American Heart Association. And Seth, you guys just put out this year's book, 2023. I call it a book because it's huge.
It is huge.
It is encyclopedic. It really covers everything you'd ever want to know. Great resource for researchers, for media, even for the lay public. Seth, would you give us a couple highlights from this year's book?
Absolutely. Well, first of all, I'd like to thank you. You actually brought my attention to the importance of this document when you visited us as a visiting professor at Hopkins years ago.
That was a long time ago.
Yeah. And you mentioned it's such a highly cited document. It's very influential. There's more than 5,000 citations from the circulation article every year. It's been produced since 1958 as a formal committee report. So we're going on, I guess, 65 years now of the statistics update, and it provides a high-level overview of what's happening in terms of CVD mortality, as well as we really dig into many detailed statistics around all the different factors that impact the ultimate outcomes of our country. So at a high level in terms of CVD mortality, what we're seeing is that the curve for both heart disease and cardiovascular disease, it's increasing over the past 10 years, and there's a number of explanations for that, one of which in the most recent years, our data do go up into the early pandemic phase, is COVID-19 and some of the issues with access to care, reluctance to seek preventive care, go to the hospital. So we're starting to understand that, and this is quite concerning, where this increased mortality. We're seeing CVD mortality rates that are now above where we were 20 years ago in 2003. And we're seeing, particularly in non-Hispanic Black adults, the largest increases in disparities. When we dig into some of the risk factors, or dig into one of the most, of course, prominent cardiovascular risk factors is hypertension. So we see that there's a now prevalence of 122 million people in our country with hypertension. And when we look at sleep in particular, we find that about a third, it's 32.8% of US adults are getting insufficient sleep, defined as less than 7 hours a night. This seems to be fairly similar between men and women, although that may change based on the age groups. And then as we get into the older age groups, there is less of that insufficient sleep, so more folks getting better sleep, but still the numbers around 27%, and there's still room for improvement there too. So that those are just, I'm pulling some statistics from this document. I definitely encourage all to go to the document on circulation. We also have materials kind of helping disseminate it. There's an at-a-glance document. There's a what's new slide deck. There's infographics. So a lot of ways to digest the materials in the way that you need it for your grants, papers, presentations, and just as you go about your professional life.
Having been the chair of that committee, I can tell you this is an incredible amount of work. You guys have taken it, 10x from when I was doing this, and you have to do it again every year. So thank you so much to you, and I think the hardest working committee that the AHA has, because it takes a lot of work to pull together all this information, and the content is solid gold, no question. Huge
thanks to Connie Sal, who served as chair this past year, Sally Wong from AHA, who along with Debbie Hurd are really kind of the heart of the document. Really, it wouldn't happen without them.
And let's not discount your role. So Seth, I know since 2010 we've actually had a chapter specifically on cardiovascular health, and it always covered Life Simple 7. This year it covers Life Essential 8. You guys pivoted really quickly to make sure we got the Life Essential 8 data in there. You talked a little bit about some of the sleep data. But as with the other things you mentioned, we see the disparity in sleep as well by race ethnic
we
groups.
do, yeah.
So tell us a little bit about that and maybe some of the reasons you think that might be true.
Yeah, I mean, first of all, thank you to you and your team for helping us it shows nice coordination within HA and the collegiality to kind of, as Life's Essential 8 is coming out, to give us a little forewarning and plan and integrate it into the HA stats update. With respect to sleep, we see that insufficient sleep is even more common amongst non-Hispanic Black adults as compared with whites and Asian populations. It's around 40% of the non-Hispanic Black population getting insufficient sleep. So that's quite concerning, and I think we need to look at the structural reasons for that as we develop solutions.
So things like socioeconomic conditions where people have to work 2 jobs or get up earlier to commute to make that bus so they can be at work on time.
Exactly.
All the things that affect people of lower socioeconomic position, which of course in this country is going to be disproportionately communities of color.
Exactly,
Yeah.
exactly.
Yeah.
And then if we look beyond sleep, we continue to see that diet stands out off year after year as a factor that's just leaves much to be desired in terms of how we're doing as a nation. So I think that's another one to pay close attention to.
Yeah, clearly right. So great session coming up where we're going to cover that and a number of other statements and recent guidelines from the American Heart Association. I'm really excited about it. But Seth, give us sort of your top line. What should people go to the statistical update to pick out and digest?
I think I'll go through some more of the stats that I shared, but actually I'll also go through some of the history of the document. I've dug into HA archives together with Sally Wong to documents dating all the way back to 1927,
Holy cow.
where we see that heart disease was at the top of the list back then. That document reported stats all the way back to 1915. So it's really interesting historical context, but to see how some of the other top causes of mortality have changed over the years. So I'll share some of those inside HA archives. This is kind of top secret material, but I've gotten special permission to share a little bit of it. So that we'll have that, and I think I'll have even more statistics such as those around pre-pregnancy, hypertension, that kind of relate to other topics that are going to be covered in the session.
Yeah, maternal health, an increasingly important area of focus for the American Heart Association. And in fact, in this session, one of the statements led by Sadia Khan about maternal health is going to be highlighted as well. So something to look forward to there. Yeah. Michael, your top line pick or takeaway?
That sleep is part of cardiovascular health. Clinicians should be asking about it, and cardiovascular health researchers should learn a little more about it. And hopefully in the session, I'll be presenting some data that can help with that.
Outstanding. Seth, Michael, thank you so much for joining me. Again, Don Lloyd-Jones here from the American Heart Association's Epi and Lifestyle meetings in Boston. Hope all of you have a great day.